Multiple sclerosis is an autoimmune condition that impacts the brain, the supercomputer that runs the body, and the spinal cord, the superhighway that takes all the information from the brain to the body and back up. Together, the brain and spinal cord comprise the central nervous system, which is responsible for all of our actions, from reading a book to taking a step to solving a complex math problem. Something triggers the immune system to inappropriately attack the brain and spinal cord, causing damage to myelin that insulates the nerves, and in some cases, damaging the nerves themselves. This brain and spinal cord damage results in disruptions of electrical communications between the brain and the rest of the body. This can result in unpredictable symptoms, including pathologic fatigue, depression, cog fog, neuropathic pain and spasticity, difficulty with vision, numbness and tingling, difficulty with bowel, bladder, and sexual function, weakness of limbs, and difficulty with walking. Everybody's experience with multiple sclerosis is different, and the neurological deficits can be temporary or long-lasting. Most people initially present with a relapsing form of multiple sclerosis, where they experience relapses, flares, exacerbations, attacks. It's all the same thing. It's when they develop a new neurological dysfunction, which sticks around for longer than a day, typically lasts for several weeks to months, and then can recover, partially or fully. Many folks with relapsing MS may go on to later develop secondary progressive MS, where they develop neurological disability slowly over time, independent from attacks. In a less common form of multiple sclerosis, people can develop a slow, insidious decline in neurologic function without ever having an attack. This is called primary progressive MS. Multiple sclerosis can be difficult to diagnose, but the diagnosis can be confirmed by a neurologist with expertise and knowledge in the disease. The workup involves taking a very careful neurological history, a complete and comprehensive neurological examination, a thorough review of MRIs of the brain and spinal cord, laboratories including blood work, and oftentimes spinal fluid as well. Once the diagnosis is confirmed, there are a host of highly effective disease-modifying therapies that will decrease the frequency of MS attacks, slow the accumulation of neurological disability, and slow brain volume loss. Our goal is to start the most effective disease-modifying therapy that the person is comfortable taking and make sure that it's working. And we want to start that as early as possible. It's our goal to preserve the neurologic reserve and to allow the brain to age as naturally as we can. Brain health and wellness strategies are also paramount to success when treating multiple sclerosis. This includes exercising as part of your lifestyle, adherence to a healthy diet and supplementing low levels of vitamin D, avoiding tobacco, and practicing daily mindfulness. There are also very effective strategies to treat bothersome MS symptoms. These include invisible symptoms such as neuropathic pain and spasticity, issues with thinking and memory, energy and mood, and difficulties with bowel, bladder, and sexual functioning. Whereas options to treat progressive MS remain limited, the future is truly bright. Worldwide research efforts are now focused on stopping progression of disability, repairing the nervous system, and regaining function. I am proud to share that at the Boster Center for MS, we are actively enrolling clinical trials. If you'd like to learn more about clinical care and research opportunities in MS, visit us on the web at bosterms.com or call us at 614-304-3444.